I have been told that I have degenerative disc in my lower back. Is there something I can do to help the aches and pains I feel from it? All right, so the more important question is to understand what pattern is acting on your back. Do you have an extension problem? Do the test that I did at the beginning of this video and see whether your back feels better with your knees bent. If it does, then yes, there's a lot you can do to solve that pain from degenerated discs. Because guess what? It's not necessarily the degenerated discs that are causing your pain. What is causing your pain is likely the pattern that's also causing the degenerated discs. This is what it means to look at things from a systems standpoint. So this is how we in medicine have to step outside of these structural diagnoses and look at these systems approaches to understanding these kinds of questions. If I was thinking from a component standpoint, well, there's nothing I can do as a PT by working on your spine and your discs to change that degenerated disc or the forces that are causing that to be painful. But there's a lot I can do as a PT to change the system that's operating and stressing that degenerated disc. Okay? So again, and then the other thing that may be also causing that disc compression, usually it'll be an extension problem. And then you also may have a unilateral problem like a side bending problem, also stressing that disc. Okay, so the next question here. I have chronic low back pain from a failed spinal fusion. I'm taking tramadol daily. I'm taking tramadol daily, but would love an alternative. Do you have any suggestions for me to help my pain and eventually get rid of medications? Okay, so yes. So this is the reason I have this question is because many people watching this may have had spinal surgeries, and maybe the spinal surgery worked for a little bit or even a long period of time, but their pain has come back again. Why has the pain come back again? If you have fused two levels of your spine and they can no longer move, why would there be pain? Well, the pain, it's because you haven't solved the system that is acting on that fusion site. And so this is the nice thing about a systems approach, is that if you do end up having surgery, then your outcome is much better because you no longer have the hammers from how you're using your body acting on those surgical sites any longer. So why would we expect, if we just put, and I'll just be facetious and say, if we put a Band-Aid on your back and it feels better temporarily, why would we expect that to last if we change nothing about how you're using your body that has caused that breakdown in the first place? Well, of course it's going to fail. Of course, it's only a matter of time before something like that fails. Now, some people, it's a permanent fix, and that's great. Maybe they don't have as significant of biomechanical hammers acting on their backs, but a lot of people do, and they're not addressed prior to surgery, and they're not addressed after surgery, and this is why pain is coming back. So yes, again, I point back to this simple test that we did at the beginning. Do you have an extension problem? Do you have a side bending problem? If you do, you can solve those. All right? All right, what is the best way to garden or weed so one does not end up with a sore lower back? Well, this is a great question because I enjoy gardening, and if you'll notice that if you have an extension problem, which means that your back is too arched, and you sit down on a stool or a small chair and bend over to weed, that initially usually feels really good. Why? Because you're flattening the spine, and that little stretch that you get in the low back feels awesome. Okay? But if you stay down there for more than 5 minutes or so, what happens is these tissues become excessively stretched, and so they start to complain as well. Now, a lot of people believe that it's the bending over that's causing their back pain, but it's often not. What's happening is when they're bending over, they feel actually better. It's when they're coming up from bending over that they're having back pain. Well, why would that be? Well, because the strategy of how they're coming back up, and this goes for if you're standing and bending down, or sitting in a chair, or sitting on the ground. What most people do when they stand back up is that they lift their head, which immediately causes the spine to arch, and then they arch their spine to come back up, pulling from their hamstrings to do so. And so what they are doing is using that extension pattern, that arching the back pattern, to come back up. And it locks their spine into that arch once they are up. And it's an excessive arch. So what's the solution here? Well, when you come back up, what you should do is bend your knees, keep your back as flat as possible in that feel-good position, while your legs are squatting you up and your back is gradually extending. So you want to make the legs as part of this coming up as long as possible. All right? So I'll kind of demonstrate. So instead of bending down and coming up like this, what you're doing is bending down, squatting, and then coming up slowly while I'm squatting myself up with my legs. That way I'm not triggering this extension pattern that I'm now locked into after I've come up all the way. The head is a big part of this too. So a lot of people, when they come up from bending over, they look up, and you'll notice that when you do that, automatically the back arches. Or even if your head is down, when you get up and you lift your head, you arch your back. So disconnecting those two behaviors is also a big deal with breaking this extension pattern problem from occurring. I hope that helps. Okay, so next question. How do you control sciatica? Which exercises work best? Well, hopefully you were watching and listening before that sciatica, and almost always sciatica, is a unilateral problem. All right? So first, it's important for you to reach back into your history and try to come up with any old injuries. Did you used to sprain your ankle a lot? Did you break your ankle? Did you have a knee surgery? Did you have a hip issue? You know, even long ago, and even if it no longer hurts anymore, likely that is the thing that is feeding this pattern that's causing your sciatic pain. So fixing this, the level, making the pelvis and ribcage level is very easy, and I'll show you how to do that in just a second. But that will continue to reoccur if you don't address the problem that's causing this pattern to occur in the first place. Maybe when you reach back into your history, you'll think, oh, well, I don't have anything on this side, but oh, now that I think about it, I have this old problem back here. When I was a teenager, I broke this ankle. Well, then that is probably the thing you've offloaded onto this other leg, and now it's saying, no mas, I can't do this anymore, and so your brain is starting to hike everything up, causing this side bending problem, creating the sciatic pain. Okay? So the answer to your question about which exercises work best depends on what is the old injury that is causing this pattern to occur. All right? So that is what you will need to focus on and test out. And I would go to a physical therapist to help you figure that out. All right? Once you figure that out, and I'll show you how to correct the pelvis, that pelvis will then stay corrected after you solve whatever that older problem is. Okay, so how are we going to solve a side bending problem quickly and easily? Well, first of all, determine that you have one. Have someone take that picture of your back, see if you have a bigger crease on one side than the other. What I do as a therapist is I get down behind my patient on my knees and I put my hands on the tops of their pelvis here on either side, and I can see that one side of the pelvis is higher than the other. And if I just move my fingers up a little bit, I'll run into that lower rib, and I can see easily whether one rib is lower than the other too, and it's usually the same side. It's very easy to feel and test. And the reason I say this is because when you have that confirmation from somebody, you can have a massage therapist, personal trainer, physical therapist, chiropractor, test this for you. Once you have that confirmation that that is your pattern, you'll be blown away by how quickly this solves it, okay? So you can really impress them if you do this little thing that I'm about to show you to correct that. So let's say that my right side pelvis is higher than my left, and my right rib cage is lower than my left. So I've got a right side bending problem like this. All right, it won't be that dramatic, but that's what I've got. So all you're going to do simply is just put your right arm up in the air, walk around the room for 10 or 20 steps, and then come back and then have that person remeasure your pelvis and rib cage, and I can almost guarantee that that will be level. All right, and you will blow your practitioners away doing that little maneuver, and they won't understand how that worked. And why? Because they are in component thinking mode rather than systems thinking mode. And so what this is really showing you is that if you correct how you walk, you will resolve this whole pattern of issues. What do you need to correct your pattern of walking? Find that old injury that's causing you not to walk correctly. Okay. And also that little tip I gave you before about, when you're walking, your body should be over the advancing foot rather than your foot advancing without you. Okay? So that's also a big deal for the walking. Okay. All right. So I have, the next question, I have severe lower back issues. Any standing causes my feet and legs to go numb. I am facing surgery next month. I know I will get therapy after the surgery, but any hints on what I can do to help me, help keep me regular would help. All right, so, okay, what is this, now that you've heard what I've had to say about the two patterns that are causing pain, why would standing cause back pain? All right, well, we just talked about it. This person, when they stand up, they are going into more an excessive extension of their spine. One of the things that's causing that excessive extension is probably locking their knees when they stand. Or when they stand up using their back to get up like this instead of using their legs to squat themselves up to get up, like I just demonstrated a couple minutes ago. All right? And it doesn't say here, it looks like feet and legs, so it's a bilateral situation, which to me, if he said one foot or leg, then I would say, oh, he's got an extension problem likely and a side bending problem. But because it's happening in both legs at the same time, I'm thinking probably more an extension problem only rather than a side bending problem. If it was a side bending problem, we'd expect to see one foot worse than the other, but that's not how the question was asked. So I'm going to guess that this is an extension problem. Okay? So I've mentioned that how we move is causing an extension problem, and I mentioned forces causing the back to arch more, but what are one of those forces that's causing your back to arch more? Even if your knees are softer, there's still other forces that are acting on that back. Well, a big one is the thigh muscles. And so the thigh muscles attach from the knee here up to the front of the pelvis. All right? These are hip flexors. They're not the hip flexors that you see targeted online all the time, the psoas muscles. Those aren't as important in solving back pain as these guys. You can imagine, look, they've got a longer lever arm that they are operating through. So they have a more significant impact on what's happening at the pelvis and back than the muscles that are right at the pelvis and back. These are often responding to larger problems in your system. Okay? So when your thigh muscles become tight, then guess what? Because they attach here at the pelvis, they cause that pelvis to tilt forward, which then accentuates the back. All right? And again, your back doesn't have to be overly arched. Just having the force acting on the pelvis, like me pushing on your chest, is enough to cause your back to tense in an extended position, causing an extension problem. Now here's the real interesting thing. You can have one thigh that's tighter than the other, which then introduces a rotational torque into the pelvis, contributing to SI joint pain, sciatic pain. It will actually cause this side bending problem if you have one thigh tighter than the other too. So there's lots of possibilities of things that are causing these larger patterns. But if you understand that there are larger patterns occurring, feeding all of this, you will be well on your way to solving this. And this is what my digital home programs and my Fixing You series of books long ago target. So the digital home programs that I have for sale now are much more comprehensive than what I wrote about in my book, because I've learned a lot then. I've owned a clinic for about 10 years. I've learned about somatics, and all of that stuff is in my digital home program. It's much more comprehensive for more problems. But anyway, that's another cause. That's one of the things that is directing force to the spine. So I would guess that this person probably has tight thigh muscles and that they are locking their knees when they're standing and walking, which is contributing to excessive extension of the spine and therefore compression and leading to the chronic numbness and tingling. All right. My back always seems to hurt getting out of bed first thing in the morning. What can I do to prevent this? Well, okay, so what I'm going to guess is when we sleep, most people are sleeping either on their back or on their side. So if you're a back sleeper, then often the knees are straight and you're in that extended position that irritates the back. Okay? If you're sleeping on your stomach, well, this is probably the worst position you can be in if you have an extension problem. So if you're a stomach sleeper, then what I would do is put a pillow or two underneath your chest, which allows the hip joints to flex and takes immediate stress off of the back. So what a lot of people have been told, they are stomach sleepers and have been told by their practitioner, hey, stop sleeping on your stomach. And then they switch to their backs, but they don't like sleeping on their backs, so they get this restless sleep because what they want to be doing is sleep on their stomachs. Well, by all means, sleep on your stomach, but just go ahead and start putting pillows underneath your chest to flex the hip joints, because it's the hip joint extension that's causing the back to arch excessively here. All right? So the more that the body is straight, the more your back is arching. Okay? And especially if you have tight thighs, that's going to even double down on that extension. So putting pillows underneath the chest here, and possibly even underneath the ankles, might help, will definitely help take its extension stress off of the spine. How many pillows? Only you can decide that, because everyone has different degrees of extension stress that are acting on their spine. So you just have to experiment with that a little bit. Okay? So that's if you're a stomach sleeper and have been told that you need to sleep on your back. But let's say that you're not a stomach sleeper. Well, then you would simply want to put pillows underneath your knees. Now, maybe you say that you've done that, and maybe your pillows have only been this high. Well, maybe your thigh muscles are extremely tight, and maybe your movement habits during the day cause these back muscles to be excessively chronically tight and contracted. Well, then this much correction isn't enough. You might need this much correction. So the degree of pillows that you need underneath your knees is informing what degree of extension problem you have. The bigger the pillows, the more forces that are acting on your spine then that you have to correct. Now, if you have back pain because you're sleeping on your side, then it's important to understand that your hips here, the pelvis and your shoulders are the widest part of your back. And so what happens is the back is sagging down to the bed and just hinging on the shoulder and hip joint. This is what causes hip pain and shoulder pain during sleeping too, and neck pain. So if we just simply put a pillow underneath the rib cage down to the pelvis here, that keeps the back level and straight and removes that side bending stress that's acting on the spine all the time. So that could also help you. All right. Okay. This was an interesting one. I am a professional musician, clarinet player, and I spend a lot of my time sitting while practicing my instrument in rehearsals, concerts, etc. The problem that I have is that I have been healing from a bulging disc on the lateral left side at L4 or L5 and have been dealing with sciatica since December 2021. I have been using Rick's exercises from this home program past several months and have nearly eliminated the radiating tingling pain into the foot. Great, good for you. The lingering problems I have, I suspect, are caused by the unnatural sitting position. You're actually absolutely right. I need to use while playing my instrument. I would like to use a chair where my back could be supported, but unless I'm at home, I have no control over what chairs are provided to me. Do you have any ideas of what cushions or pillows I could use? I have some Mackenzie rolls that work on my computer chair and my car, but this wouldn't work with music chairs. I believe because music chairs are actually like stools. I feel I have to arch my back too much to sit in a good position to play my clarinet, since I have to sit at the edge of a chair to play. All right, so now that you understand how I look at the body, you can see probably why this person is having their pain. So, and they're saying it themselves. They fixed their side bending problem causing sciatic pain, but they have to sit at the edge of a chair, which is causing them to arch their back excessively. How do we fix that? Especially if you don't have a back of a chair to use. Well, the first thing would be to lower the height of the chair, right? So your knees will then be more bent. Get that chair as low as possible, and that will put your back into more flexion. That would be the easy first answer. The second answer I would say is eliminate the stressors acting on your spine before you're playing in your concerts, so that if you are sitting in an arch position, you have fewer stressors trying to pull your spine into that arch. What are those stressors? Well, I just talked about those. Tight thigh muscles are a biggie. Not locking your knees when you're walking. When you're walking, start letting your body pass over the foot at foot strike. All of these things reduce extension problem stressors. So those would be my tips. I thought that was an interesting one, dealing with ergonomics. Okay, does stress or anxiety play a role in making back pain more intense? Yes, it does. And so I'm going to geek out a little bit on some medical terminology here for a second, but stick with me, you'll get it. So Thomas Myers is a fascial researcher. Fascia is connective tissue that connects everything in the body to everything. Nerves, blood vessels, muscles, ligaments, bones. It holds our viscera in place. Everything and everything is connected by fascia. And fascia even has microscopic connections into cells. That's how invasive and pervasive, I should say, it is. But Thomas Myers identified superhighways of fascia that run from the top of the head to the bottom of the foot. And these superhighways of fascia, which all, of course, include muscle and ligament and tendon, can be dissected from the body as one continuous piece of tissue. What does that mean? It means that anything from the bottom of the foot can affect the top of the head and vice versa. Okay, so the interesting thing about fascia is that there's a certain type of fascia called myofibroblasts. Myo means muscle. And so this fascia has up to 4 times the contractile capacity of normal fascia. So it acts more like a muscle. Well, myofibroblasts are laid down in areas of mechanical strain in the body. And where would those areas of mechanical strain be? Well, if you look at the spine has these curves. It has a lordotic curve, and then a kyphotic curve, and then a lordotic curve, and then a kyphotic curve at the pelvis. Well, where those curves are changing is where there is natural mechanical stress. All right? So naturally, more myofibroblasts will be laid down where these curves are changing. Now, what makes the low back in particular very difficult is because you've got this large pelvis that is a block, and wherever it goes, then this spine, which has multiple joints in it, all little joints like this, has to respond to that. And so those little joints absorb things. This is why most of the problems in the low back occur at L5, which is the lowest lumbar vertebrae, and then S1, which is the beginning of this big block of bone right here at the pelvis, because this has to absorb a lot of the mechanical stress. Okay, so myofibroblasts are laid down in these areas of natural mechanical stress. Now, there could be many others in your body depending on how you've used your body in the past. You know, the sports that you've played, the exercise that you've done, the injuries that you've had. All of those cause more myofibroblasts to be laid down in particular areas of mechanical strain that you've created. Here's the interesting thing about myofibroblasts. They do not respond to neurological input. They are not controlled by nerves. They are controlled and contracted by cytokines, specifically one called transforming growth factor beta 1. Well, that all sounds, I don't know what any of that is. just know that it's like a hormone that circulates in your bloodstream, all right? And so what happens is when we are under stress, it causes our immune system to release transforming growth beta 1. And guess what? That circulates through your bloodstream, finds the myofibroblasts, and causes them to contract more. Remember, they have up to 4 times the contractile capacity of normal fascia. So when we are stressed, we have more contraction in our mechanically stressed areas of our body. Well, the stress is not only from meeting deadlines or fighting off, tigers. It is from emotional stress, emotional trauma, depression, anxiety, all of these types of things, and also internal stress. For instance, if you're dealing with an allergic reaction or you're allergic to foods or mold or things like that, your body responds by generating tension, all right? Well, a lot of that tension will occur in the mechanically compromised areas of your body because of the release of this transforming growth factor beta 1. So that is how stress and anxiety play a role in making back pain more intense. Thanks for sticking with me on that one. Okay, so the next one, I have fibromyalgia, sciatic pain, and severe arthritis in my left hip, back, knees, and hands. So right off the bat on this question, left side, I'm thinking left side bending problem, which means some problem with how they're using their left side in 80 to 90% of the cases. That's immediately what we should all be thinking about immediately, okay? They need to figure out what that old problem is. Or in 10 to 20% of the cases, it's a problem on the right side that's causing them to shift to their left, and now it's overloaded. Okay, so I've tried so many things, and something temporarily lessens the pain, but it comes back right away. I am now using a cane to walk, but every step I take is painful. I am a full-time caregiver to my husband, managing daily stress and getting enough sleep is also difficult. Daily, I stretch, use ice, heat, and go on a vibration power plate. I do yoga, ice, and heat again. I use TENS, stimulation, so all of these kinds of things. I see a physical therapist, chiropractor, and have cortisone shots in my sciatica and hip with little relief. I am at my wit's end with this pain. I only take Tylenol arthritis for pain relief, but it does not help. Does your book offer any other helpful suggestions? Well, I think, they're referring to my Solving the Pain Puzzle book. And so that Solving the Pain Puzzle book is showing case studies of people like her and how I have used this systems thinking to solve their pain, all right? So right off the bat, so we know that they have likely a side bending problem. So they're practitioners, and if you look at all of the things that she said that she's done, ice, heat, yoga, heat, TENS unit, Epsom salt baths, all right? All of those are component thinking types of solutions. And almost guaranteed that her chiropractor and physical therapist are component thinking too. So they're likely looking right there at the SI joint, the piriformis, maybe the hip joint, and the back, all right? This is the zone that they're looking at because we're trained in component thinking to treat the site of pain and solve it, all right? But it can't be solved because the larger lever arms are not being addressed. And this is why she can't solve her problem. I can almost guarantee it. So, and especially now using the cane, I don't know which side she's using it on, but if she's using it on her left side, now every time she steps on that side, she's probably side bending even more on that side if that cane is there. And if she's on her right side, I'll show you this little trick. If you put your hands on your waist muscles here and you shift over to your right side and slightly lift your left knee, you'll feel your left waist muscles engage. And your right waist muscles are relatively lengthened and relaxed. And then if you shift over to your left side and lift your right knee just a tad, you'll feel your right waist muscles engage and your left waist muscles are relatively relaxed. So if we have left sciatic pain and we're shifting over to our right side to get off of that, it's then contributing to the side bending pattern that's causing the sciatic pain in the first place. That is a non-intuitive solution, all right? We think we have to get off of that, and the more that we get off of it, the more it will allow it to heal. But the more you get off of it, the more you perpetuate the pattern that's causing the sciatic pain in the first place. How do we solve this? You have to learn to stand on that left side while allowing lengthening to occur. All right? That's what this is showing you, that that's how the body is operating. But what happens with most people with sciatic pain, either they're shifting to the opposite side to get off of it, or when they stand on it, they collapse. Why are they collapsing? Because of some older problem in that side and they can't hold themselves up well. This is again where that walking with the arm up in the air really helps out, because that's teaching your body to weight bear correctly while maintaining length in the waist, which corrects the side bending problem. Again, that will be a temporary solution until you solve the lower body problems that are causing you to have this pattern in the first place. But it's a nice temporary fix to help get you to start getting out of that pattern. Okay, let's move on. I have lower back pain after a car accident a few years ago. I had physical therapy and pain meds. It got better, but it never stopped. Okay, so this is another, this was a really interesting question, I feel, because I run into this a lot. I didn't have any back pain until I had my car accident, and now I have chronic back pain. No one can solve it. Why is that happening? Well, the answer is because your body wasn't perfect before the car accident. Likely what happened is that you were functioning just well enough to not have pain. So a lot of people are walking around with side bending problems. In fact, if you go to an airport or a mall and start watching how people are walking, you'll see how asymmetrical people are just in using their bodies walking. A lot of these people don't have pain. Why? Because our body has many redundant systems that allow other things to take over if there's a weakness or tightness or problem somewhere. Because remember, our brain is about getting from A to B and being successful. So it will allow those weaknesses and tightnesses and so forth to occur as long as it's getting you from A to B, which is your focus. All right? So a lot of people over time have developed tightness, weakness, movement habits, and so forth. And because of these redundant systems, they don't yet have pain. Well, now you've got something like this happening, or maybe you have an extension problem, and then you have a car accident that causes everything to contract more. And what happens is the patterns that were about to cause you pain, yesterday, are now in full contraction mode. So now you're locked in this pattern, and you can't get out of it. Why? Because your practitioners are focusing just on this site of pain instead of the global system of problems that has been occurring in your body up to that point that you were unaware of because it didn't yet rise to the level of pain. So people with, and this goes back to that question about anxiety and stress, car accidents, that is a traumatic event. Stress, anxiety are traumatic events. And whenever we experience some type of trauma, either emotional, psychological, spiritual, if we have an internal organ issue like IBS or something like that, or Crohn's, or we have allergens or mold that we're fighting, our body responds by generating tension. All right? That tension occurs in these patterns that Thomas Myers identified, that fascial researcher, but also have been also found by Dr. Thomas Hanna, the somatics instructor, the somatics course I took, and Dr. Shirley Sarman, the biomechanics professor that I studied under. So all three of these people in three different areas of study all identified the exact same patterns of dysfunction that are occurring in our bodies causing pain. Dr. Thomas Hanna's work in somatics is the only work I've found that approaches this neurological tension pattern and how to unlock it. That's what the somatics exercises are in my digital home programs. And so what these people need, the car accident, the stress, anxiety, people who have been locked in chronic pain patterns for a long time, usually it is a neurologically based tension that is contributing to them being locked in these patterns, the extension problem pattern, the side bending problem pattern, and that's why they can fix little things and it keeps coming back because they're not addressing the global tension pattern that their whole body is stuck in. The only way I've found to unravel that is using somatics. It is a miracle for a lot of people. And so that's why I've put it in all of my home programs. I have created 8 lessons to help people unravel different patterns of tension that could be contributing to their chronic pain and they're unaware of it. So that would be how I would start with this person after a car accident is, hey, that's a traumatic event. Likely that body is locked into this contraction pattern. The somatics is the best way to get out of that initially. Because if you try to stretch or strengthen your way out of it, what your brain, the ultimate controller of your whole body system, is saying, oh, I've still got this tension though. And so it will recontract that stretching or strengthening or whatever, and you'll just be running in circles. You have to unlock your body's tension pattern first. Okay. How to deal with left lower back pain. I am 68, about 30 pounds overweight, and was and still am a teacher during COVID. So I was suddenly sedentary, sitting 90% more of the time. I do have arthritis in SI joints and low lumbar joints, and my hip is tight on the left side too. Hopefully you all are already thinking, oh, I bet she's got a side bending problem, and you would be absolutely correct. And now you know how to start fixing that. All right, I did go to PT, but she gave me 22 exercises to do daily. This is classic physical therapy, which seemed too much with my schedule and wanting to do other exercise, walking and weights. 10 daily would be more doable, and my home programs are more like maybe 7. So I work very long days as a teacher. Thank you very much. So right off the bat, I'm thinking, okay, and you know, we've already identified she probably has a left side bending problem because it's her left lower back, and she happens to have left hip issues. Now here's a really interesting thing about this question is often everyone thinks that, that the back issue is feeding the hip issue, but actually it's usually the opposite. A hip issue or knee issue or foot issue is actually what's feeding the back issue, because the back is responding to that problem in that lower body system. Hopefully you're getting that idea now. That and yes, you can get then neurological symptoms that go down the leg, but that's the loop, right? It's the leg that's feeding this pattern, which then creates the ridiculous symptoms that then run down the leg. So addressing the spine may be correct temporarily, but if you don't address the biomechanics that are causing the spine to have this pattern in the first place, you'll never get where you really want to go. The same goes for the upper body system, which I'll be talking about in another video. Ridiculous symptoms down the arm are attributed to neck problems, which may be correct, but there's something else feeding that neck problem that's causing the ridiculous symptoms to occur. So just treating the neck isn't going to be enough. You've got to fix the foundational problem that's causing that ridiculous issue. All right, so yes, fix the hip, fix the left hip, and I will go over hip questions in another video, and that will start to fix your gait pattern, which will correct the side bending problem. In the meantime, you can do that arm over your head walking to fix the weight bearing issues on that side of your body and level your pelvis and rib cage. Hopefully that will be enough to start eliminating your sciatic issues. Okay. All right, I am only 38 and disabled due to extreme lower back and hip pain. Here we go again, hip pain. At night, I am only sleeping 2 hours at a time or less due to pain waking me up. I have been through 4 mattresses in 2 years and nothing has helped. Well, I think you all can understand why that has not helped yet, right? The answer is because it's not the mattress that's causing the problem. It's how they're using their body that's causing the problem. So what is the best stretching exercise I can do to not only help with the pain, but also help with the decreased range of motion that keeps getting worse? So hopefully you all are understanding now what you can probably anticipate what my answers are. First, you have to find out which pattern that you have. And then you've got to figure out, oh, am I locking my knees? Am I walking correctly? Do I have tight thighs that are all contributing to this extension problem? Do I have a side bending problem? Oh, if I do, then do I have an old problem on this side, or is it on the other side that's contributing to this problem? I've got to fix that. Well, how can I fix it temporarily? I'm going to hold up my arm while I walk on that side to level my pelvis until I figure out the rest of the stuff. All right? So this is the way that you need to start thinking about these chronic pain conditions. Now you're starting to get an idea of this systems thinking. Okay. So I have chronic migratory back pain. Pain continually moves throughout the entire back, the buttocks, and the side and front ribs. Is this treatable, and is this a common condition? I wouldn't say it's common, but I believe it is treatable. Again, I now sound like a broken record now that you all know how I'm looking at the body, but I would venture to say this person likely has an extension problem, and if they just did that simple test I did at the beginning of the video, they would find out. They may have a side bending problem, but then there's also this global tension pattern, I bet, that's occurring. When I hear about pain wrapping around the whole body like that, I think, oh, this person has some kind of neurological tension pattern going on, and the somatics lessons will likely be a big help to them. All right. Why does my lower back hurt so bad when I stand more than 10 minutes? Now you understand. It's not that you're standing 10 minutes, it's how you're standing for 10 minutes. If you start unlocking your knees, I bet you will have no back pain at all, or you can probably get by with at least 30 minutes of standing. So try that out. I have worked on my core and I do run, which could be an issue. It does not hurt when I run, but when I finish and go down to stretch it out, it's so sore. Okay, so this is why I chose this question too, is because a lot of people have been told that their core is just too weak, and that's why they have back pain. Well, look, if we look at this from a physics standpoint, if you have pain here and your core is right here, what has a larger, what has more effect on this pain here? Is it something that's right here, or is it something that's acting as a long lever arm here? Hopefully you all are answering that it's this long lever arm that's acting on the pelvis and low back, and that has much more influence on the low back than something that you're focusing on right here. So focusing on core strength is very common in medicine because of it's a component thinking approach, right? Well, what are the things around this little area that we can improve upon to help, take stress off of this area? And well, the core is a massive muscle structure, so let's focus on core strength. But many of you have probably been doing tons and tons of core strengthening, all different kinds of core strengthening, yet you still have pain. Well, that should be an indication that the core is not the problem. It's the lever arms that are the problem. Okay, we're almost done. Okay, so this feeds into this next question. What is good back posture, and how to keep a good back posture? So let me go over how I ideally train for proper posture. All right, so will everyone put a hand on your chest, and now put a hand on your belly. Take a deep breath in. Feel the rib cage lift. Exhale, and you'll feel the rib cage lower again. Okay, let's do that again. Inhale. This time when you exhale, exhale all the way, but don't let the rib cage fall all the way. It can fall 99% of the way, but not that last little millimeter. So exhale and let that fall most of the way, but not all. And you'll find that your belly muscles have just contracted a little bit, maybe 5 or 10%. This is your core holding up your rib cage. This is what it's designed to do. That's why we have so many layers of core muscles, and that they attach to this huge broad swath of the body. They've got to hold up this massive system up here. All right? And this is how they naturally turn on. It's just by lifting the rib cage ever so slightly, you'll turn them on. And the 5 or 10% that you're feeling is all that you need to turn on. More is not better, because now you contract everything and cause more tension in your system. Notice that I've never asked you to contract your core muscles. I've just asked you to lift your rib cage and let the core muscles activate as much as they need, all right, which is very little. Now, again, more is not better. I don't want you to lift your rib cage way up here, well, then I'm going to hold it up here, and then you're going to create all sorts, because now you're extending your back, of course, right, which we don't want. And then you're going to uber contract your stomach, and it's going to be way too much. No, don't overdo it. It's just a little teeny tiny bit, just enough to activate them slightly. Now the second part of this is to bring your arms down by your sides and loosen up your shoulders. And you'll find that when you completely relax your shoulders, you've just let go of your core. Why is that? Because you've tied your posture strategy to squeezing the shoulders back instead of activating the core. You have to decouple those two parts. The shoulders should be like dangling loose ropes by your sides while you can hold the rib cage up ever so slightly and feel just that very whisper of core activity happening in your core. Now you're using a proper posture strategy. The shoulders do not have any place in generating posture. That's not what they're designed to do. Look at the architecture of the shoulder system. It's resting outside of the rib cage, on top of it. Why would that have a role in creating posture, right? It's a secondary helper, but it shouldn't be involved at all, really. And this is why a lot of people have chronic neck pain and headaches, by the way, which we'll get into the next video. Okay, so that's how I train proper posture. It's called lifting the rib cage. So here's the last question. So what physical therapy exercises for lower back pain should be or should not be used with patients with Ehlers-Danlos syndrome? So that is a syndrome that is highlighted by excessive mobility of joints. For instance, people with this syndrome, in general it's called hypermobility syndrome. If you can stretch out your arms and your elbows bend backwards, and if you can straighten your knees and your knees bend backwards slightly, right? Mine can't, I don't have it for sure, I'm a tight guy. But if I could, hyperextend those elbows even slightly, that means that your ligaments are too loose, because the elbows and knee joints are two joints, definitively that should not be able to bend backwards. So if they can, it means that your ligaments are too loose. And so for these people struggle with chronic pain because what they feel is that they need to stretch all the time in order to relieve their pain. But by stretching all the time, they are excessively extending their joints, and they're stretching the ligaments, which are already too loose in the first place. All right? So these people need to focus more on strengthening and muscle activation patterns than they do on stretching, because usually they're really good at things like yoga, Pilates, gymnastics, swimming, things like that require a lot of flexibility. That's what these people tend to gravitate to as solutions and as in terms of exercise. But what that's doing is reinforcing the pattern of problems in the first place. They need more strengthening and muscle activation patterns. Okay? So in general, for people with hypermobility syndromes, when you're doing strengthening, I recommend, for instance, that you do just a mid-range of motion strengthening. Don't even approach full range of motion, because full range of motion for you is excessive. So I would learn to decrease the range that you're working through and think about the muscle activation patterns. For instance, we didn't go into it a lot here today, but your gait pattern to turn on the lower body muscles intuitively. The lifting the rib cage to turn on the core naturally. All right, these kinds of things. More is not better when you're dealing with hypermobility syndrome, because your primary stabilizers are excessively loose. Muscles serve as a poor secondary stabilizer. They will never be as strong or adaptive as your ligaments could be. So that's why I wouldn't overdo it with weight training. I would just do enough to do a little bit of toning, keep the weights lighter rather than heavier, and work in a smaller range of motion and focus on that mid-range movement to strengthen your body. Okay, folks, so that's all I have for answering Bob and Brad's Facebook questions. And I hope this helps you get answer your own questions for your own pain. Hints of whatever is happening in you, I've answered in bits and pieces throughout this whole video. So please take what you need and start trying to apply this. And I think you'll feel better almost immediately. Thanks for watching.